Good evening, everyone. Sapna this side with you, and welcome to today's session of Ask FUH. With me is today Dr. Tommaso Tufo. He is our consultant neurosurgeon at Fakir University Hospital. And our today's topic of discussion is pretty interesting. It's brain tumors. Welcome, Dr. Tommaso.
Thank you. Thank you very much for this opportunity. And it's really an important topic for me. That I can say I'm 50% brain and 50% spine surgeon, so for me it's a good opportunity to share my experience and to give some advice.
Yeah, that's pretty interesting to know, Doctor. 50% brain and 50% spine. Doctor, we have questions, those who are lined up, and I want to start with a couple of those. This is a quite basic question, but yes, we all would like to know more about it. That what are the symptoms for brain tumors?
Yeah, I'd like just a brief introduction, just to say that brain tumor is a kind of rare condition if we consider that is just 2% of all cancer condition in the population. But the incidence we can say is about 7 in 100,000 population, so sometimes it's not so low.
Okay.
And the fact, the symptoms, why it's important to discuss about this, because sometimes we have some general and not specific symptoms for a brain tumors, because you have to think our brain, so our skull is a kind of box, quite rigid. So inside our skull we have our brain, vessels, some fluid, this particular fluid. So just because this box is rigid, so everything, if is something growing, a mass, a tumor inside growing, you can see we'll have a pressure of the normal brain.
Okay.
So that's why these symptoms sometimes they could be related to this pressure. Mm-hmm. It means some part of the brain not functioning in an appropriate way.
Okay.
So we can see most of the cases they can refer just simple headache, persistent headache, nausea, vomiting, and it could be, there's a kind of experience that is quite common in the population.
Okay.
But why you need to investigate in some specific case. If there is persistent headache for sometimes days or weeks, or with vomiting or some neurological issue that we will discuss. In that case, it's better to refer to the hospital and to the neurosurgical clinic. Of course, other symptoms, they are more specific, because the general symptoms like this can be associated to some neurological deficit. What it does mean? Some part of our brain has some specific function. It means we have part of the brain dedicated to the speech, to the movement, to the sensation. Mm-hmm. So we can have some specific symptom related to the compression or a mass in one part of the brain, like weakness, reduced power in one part of our body, or abnormal sensation, or sometimes a seizure, because we have irritation of this part of the brain.
Right.
So we can say that symptoms.
Symptoms matters a lot, right? And Doctor, suppose there is a patient who has been. There are symptoms for brain tumors, and it gets referred to your clinic. What kind of clinical or say radiological investigations, or what are all investigations which you will ask the patients to go for?
Okay. We have to consider a patient with suspect of a brain tumor needs a neurological examination first.
Okay.
So it means you need to check if there is some issues with the speech, sometimes with the mood, with the movement, sensation. There's a kind of a basic. Then, when you have a suspect of something, abnormal in the brain, you need to prescribe the radiological investigation.
All right.
In that case, we have CT scan examination, and if you want to check some urgent condition, because sometimes this kind of tumor, they can have big size, so you need to be fast, you need to check fast if there is condition like this. But the gold standard for the investigation of the brain is the MRI scan. MRI scan is sometimes an advanced radiological examination. There are different techniques that they can make clear the picture inside your head and make clear it's the tumor, and sometimes have a sort of diagnosis in some cases about the nature of the tumor.
Okay. And doctors, you have done your clinical and radiological investigations. When do you think that the surgery is required then?
Okay, so brain tumors is a kind of, we can say we have more than 150 types of brain tumors, and not all require surgical procedures, because we can find sometimes some small benign tumor that require just follow-up. Or sometimes you can find some small tumor but with some malignant behavior that needs treatment. So the selection of the patient, his history and the neurological examination is really important, because of course a patient with small benign tumor with no symptoms can be treated in a conservative way. But on the other hand, when you see a patient with neurological issues and sometimes some of these symptoms with a mass in the intracranial mass, you need to consider the surgical option in that case.
So doctor, you mentioned that there are 150 different kind of brain tumors. Do we have any kind of new surgical techniques or any kind of procedure which is available in our hospital which you think that which will be beneficial for these patients?
We have different options and different techniques for brain tumors. Of course, just because the type, we have this kind of different type and different location, we can consider different kind of technique. We have in our hospital, of course, the endoscopic technique available, microscopic technique, the use of intraoperative particular neuromonitoring to do the surgery with the respect of neurological function. So is a kind of, the neurosurgical procedures is a kind of delicate process, I can say. So, and it requires a sort of dedicated equipment too, and of course dedicated skills of the surgeon, of course.
Okay. So this is useful, Dr. Tommaso, and I have my last question. Do you have any recommendation for the audiences, those who are watching us today?
The recommendation is when you have some issues in terms of problems like headache or some issues with your a part of your body in terms of reduced power, abnormal sensation, issues with your vision, refer of course to your GP, to your doctors, and then try to discuss this kind of symptoms with a neurosurgical clinic, with a neurosurgery. Just because we know is a kind of we can consider rare condition compared with other cancer, but is a condition still present and needs to be investigated properly.
Okay, thank you so much, Dr. Tommaso, and this is really helpful. Not much talked about topic, brain tumors, but signing off today. Thank you so much, everyone. Sapna with you, and with me is Dr. Tommaso Tufo. Thank you so much. Thank you.
Thank you.